Hi there, my name is Dr. Dr Crespi. I'm a paediatric gastroenterologist. Today I wanted to talk to you about celiac disease in children and how you as a parent can help recognize some of the symptoms of it and then how it is diagnosed and then managed. If you are at all worried about your child's health in terms of symptoms of any nature, but particularly also in this case, anything that overlaps with what I'm about to talk to you about in the video, please do seek the appropriate medical attention from an appropriate healthcare specialist, be that your family doctor, general practitioner, paediatrician, or paediatric gastroenterologist, so that they can thoroughly evaluate things together with you and take the next best steps. Please do not use this as a means to diagnose celiac disease in your children on your own. So I'm going to talk to you about what celiac disease is, how it affects children, and how it is diagnosed and managed. As always, I used evidence-based guidelines, and over the years, these have changed quite dramatically from when I first started out in practice and in my training, from having a certain approach to making the diagnosis to what we have now. And over the last 12 to 13 years, it's really changed quite drastically. The latest guidelines came out in 2020, and that's what I'm basing this video on. Just as a reminder that our gut, an amazing organ, stretches from the mouth right down to the bottom. It's got several different areas that each serve a different purpose and function. And for this situation that we're talking about today with celiac disease, I'm focusing on the small intestine, which stretches all the way from the duodenum, that first part of the small intestine that is just after the stomach, and goes all the way down to the end of the small bowel, which is the ileum. It's the upper parts, the duodenum and jejunum, which are particularly affected by celiac disease. So celiac disease is one of a group of conditions that we call autoimmune conditions. This is where the body's immune system or defense system that's normally there to protect us and defend us against invasion by various things such as bacteria, viruses, fungi, etc., for some reason is triggered to react against the body's own organ. A common autoimmune condition is diabetes, or type 1 diabetes, where the pancreas is then effectively made to malfunction so that it cannot control or regulate blood glucose levels or blood sugar levels easily. So celiac disease is one of those, and in this case, it's the defense system or immune system is triggered to react against the small intestine, but it only occurs in those with a genetic predisposition towards developing it and in those who've had gluten. It's much more common than was thought previously. When I was in medical school, it was thought to be pretty unusual, but actually it's thought to be as common as perhaps 1 in 100 people. And the toxic ingredient here is gluten, which is ubiquitous, widely spread throughout the diet across the world. It's a storage protein in cereal grains such as wheat, barley, and rye. And for some reason, in those who are predisposed to it with that genetic predisposition, the gluten interacts with the bowel wall, triggers the immune system that then sets off a series of problems in the bowel that causes damage to that small intestinal area, which is really crucial for absorption of nutrients that we need, carbohydrates, fats, proteins, for example, from our diet. So damage there is pretty important. In terms of symptoms in children, what you could look out for gastrointestinal symptoms, there's a diverse, wide range of symptoms that can be involved, from diarrhea or constipation to a bloated or distended tummy, vomiting sometimes, and sometimes chronic or long-standing tummy aches is another one. So quite a wide array of symptoms just to be aware of. It can also affect other bodily symptoms too, so you may not always think they're coming from the gut. A common one is tiredness, probably because of iron deficiency that occurs because iron's absorbed in that area of the small intestine, which we talked about a little bit earlier on. It can affect girls with period problems as well, and it can also stop children who are developing and going through puberty doing that properly, so they can have problems with that. Mouth ulcers is a fairly common phenomenon too. There's a certain type of skin rash called dermatitis herpetiformis. I won't go into a great deal of detail about that now, but that's particular to celiac disease. It's effectively celiac disease affecting the skin. And there can be teeth problems, bone problems with thinning of the bone and osteoporosis, so that one's more predisposed to fractures. Sometimes blood tests can indicate there's a problem with liver, and that can be because of celiac disease in some instances. There are some other more unusual presentations, which I'm not going into now, but they can affect your nervous system too. There is a whole range of autoimmune conditions that can be associated with celiac disease as well. We touched on diabetes or type 1 diabetes before, and that's actually fairly common in my practice, that I see a lot of children who come to a paediatric gastroenterology clinic because they've been diagnosed with diabetes and they're being monitored by their specialist team for that. And every year they have a screening set of blood tests, and one of those is a celiac test because we recognize there's that association. It can also affect your thyroid and liver tests as well, and there can be autoimmune conditions that affect those. So screening tests can be used in those groups of patients too, and can sometimes pick up this as a possible problem. Some genetic conditions, including chromosome problems such as Down syndrome, where there's the extra chromosome 21, or Turner syndrome, and some others, can be associated with celiac disease. But it's also, again, as we touched on before, more common in family members, particularly the first degree relatives, so a parent of somebody with it, or child or sibling of someone with it. They're more likely to be affected by it too, so we can screen them for it. It's important to go through the stages of how we evaluate it properly. That involves having a consultation to go through the clinical history of the symptoms and what are the main troublesome problems that your child may be experiencing, then organising for the appropriate blood tests. For celiac disease, there are particularly two types of blood tests, TTG, or tissue transglutaminase, and endomysial antibody. These should be performed separately when evaluating for celiac disease. And it's crucial to also check that anybody being evaluated for celiac disease does not have a low level of immunoglobulin A or deficiency of that protein. That's a fairly common situation to occur in certain populations, so it's crucial to make sure that you're not missing that as a possibility, because then you can have a misleading result. So that's why step 3, when you interpret the results, is really important to take all of that into account and evaluate things. And we'll go into that in a little bit more detail soon. The next step of the diagnostic pathway, usually in the past, everybody would have had a biopsy obtained during an endoscopy. The endoscopy, just to remind you, is a camera test that we perform where we put a specialized floppy type of camera into the bowel. It's got a video at one end and a light. It records the video as we do it, and we can then obtain little tissue samples or biopsy samples from the lining of the small bowel or other sections of the bowel. In this case, it's the small intestine we're focusing on again. Now, just to show you a highlight picture of that, this is what a intestinal biopsy looks like. You can see the probe, which is blue colored here with a silver tip, is just grabbing a little bit of the lining of the intestine there. That then gets processed and analyzed further. It's really crucial also, and I'll repeat this a few times through this presentation, that actually you should stay on gluten throughout the diagnostic process to avoid any confusion in interpretation of results. Once we get the blood results back, we may find that they're normal. Now, that would usually say or mean that you don't have celiac disease, but of course there's caveats and things to remember. It's important to always be on gluten throughout this process. If you're not on gluten, then there is a possibility that you could have a false negative result. Again, also the importance of checking for the immunoglobulin A test being performed as well is crucial. If you get a mildly abnormal result with the celiac testing, then the recommended advice is to go on to have the gold standard test in that situation, which would be having an upper GI endoscopy and having a biopsy, the so-called biopsy approach. Again, staying on gluten. Now, what we call a very high result is having a result that's more than 10 times the highest normal result possible in that laboratory. So in our laboratory, 0 to 6 may be a normal range. So anything more than 60 for the TTG test would be a high result. Then we need to perform the second test, the EMA test. That needs to be positive too. If you fulfill those conditions, the high result plus the MA test, then this could confirm the diagnosis of celiac disease without having a biopsy, the so-called non-biopsy approach. It is possible to still go for an endoscopy in this case as well, but most people these days would suggest actually that's not necessary. Why put your child through the risk of having a general anesthetic to have an endoscopy if there's no need to, if the blood results are enough? So here are the three different pathways. Normal results, probably not celiac disease, as long as you've not got any of those other issues that we talked about before. So if an endoscopy is needed, and just to remind you again, that's a procedure in children that's performed under general anesthetic, then again, the advice is to stay on gluten all the way through all these diagnostic tests. And the aim is to try and reach the small intestine and take biopsies from that section there. And you can see that when we reach the small intestine, and I still love this view, you can see the small intestinal villi, or these little structures that are crucial to absorbing nutrients. There's thousands of these, like a carpet of them. And once you get the biopsy, then it's processed and analyzed under a microscope, and you can see the villi in this slide here. In celiac disease, as we mentioned before, there's a process that started off by the gluten that triggers off the immune system to attack that area of small bowel, and the villi themselves are missing. So that when you look at them under a microscope, you can see that there's an absence of those villi. They're not there, so that your bowel can't function in the right way. It can't absorb things properly. So your child's had their symptoms, you've raised the alarm, you've seen your specialist, they've done the blood tests, they've been interpreted, and they may or may not have needed an endoscopy too to confirm the diagnosis, depending on those results. We've got the diagnosis confirmed now. At this point, it's really important to appropriately explain what the condition is to the family and your child in an age-appropriate manner. And I call upon a lot of resources to help me with that as well. And only then, when we've confirmed the diagnosis, would I suggest going onto a gluten-free diet. Pulling all gluten out of the diet is the most effective and only treatment that we have for celiac disease. And I would always recommend having a paediatric dietitian who's highly specialized in the knowledge of this condition and managing diet and diet exclusions in children to be involved. Other steps I would normally recommend is, as we talked about before, it's more prevalent and more common in immediate family members, so would normally recommend screening other family members for this as well. And other valuable sources of support include Coeliac UK, which is a phenomenal charity that's the national patient charity for this condition in the UK. It's also important to have established a regular follow-up schedule with your specialist or paediatric doctor who's got an interest in this condition, and that should be done with appropriate professionals. And sometimes you may need the dietitian involved again to go through things or review things, especially at different ages. So I hope you've gathered from this that celiac disease is a very common autoimmune condition, and it can present itself in so many different ways, from a variety of gastrointestinal symptoms or non-gastrointestinal symptoms to sometimes having no symptoms at all and just being picked up because of blood tests or being screened from other conditions. It's really important to get the right people involved to evaluate it and then manage it. And it is crucial to have interpretation of the blood results performed properly and staying on gluten throughout the diagnostic process, however tempting it may be to come off gluten after advice from colleagues or friends to do so. It's best to stay on gluten throughout the diagnostic process so as not to muddy the waters. And it's safely treated by using a gluten-free diet. I hope you found this helpful.